Hey there, I'm Dr. Dallas Leah, and today I want to have a little chat with you about something called cervical dystonia. Now, before you panic about the big words, let's just break it down together. It's really not as scary as it sounds, I promise. We'll go over what it is, what causes it, and most importantly, what we can do to treat it. And because I like to keep things light, we'll have a little fun along the way. Alright, so what is cervical dystonia? Well, it's basically when your neck muscles decide they have a mind of their own. Imagine you're sitting there minding your business and your neck suddenly thinks it's time to turn to the side or tilt forward or backward without you telling it to. That's cervical dystonia, your neck muscles getting their wires crossed and doing their own thing. The muscles might contract, spasm, or just get stiff, which can be pretty uncomfortable. Now, the culprit behind this? It's a part of your brain called the basal ganglia. Fancy name, I know, but it's the part that helps control your movement. And when that part of the brain starts sending mixed signals to your neck muscles, they start pulling and twisting in all kinds of directions. And yes, it can be painful, or at least really annoying. The big question people usually ask is, what causes this? Well, that's a bit of a mystery. We know it's something to do with the brain, and for some people, it might be genetic. Other times, it just kind of happens out of nowhere. Lucky us, right? But hey, don't worry too much, because there are treatments that can really help. Before we get to those, though, I want to take a quick detour and talk about a special type of dystonia called whiplash dystonia. Have you ever heard of whiplash? Yeah, it's usually from something like a car accident, where your neck gets jerked around. Well, sometimes after trauma like that, the neck muscles can go haywire and develop dystonia. We call this whiplash dystonia. So how's it different from cervical dystonia? Well, the big difference is that whiplash dystonia comes after an injury, usually trauma like a car accident, where your neck's been through a rough time. But the symptoms are basically the same. Your neck muscles start spasming, your head tilts or turns without you wanting it to, and it sticks around longer than a regular case of whiplash. The good news is that the treatments for both cervical dystonia and whiplash dystonia are pretty much the same. So, let's talk about how we can help you out if your neck's decided it's in charge now. One of the best treatments out there is something you might have heard of, Botox. Yep, the same stuff people use to smooth out wrinkles. But when we use it for dystonia, Botox does something really cool. It blocks the nerve signals to your muscles so they relax and stop spasming. You'll usually get injections every 3 to 4 months. It's not a cure, but it sure makes life easier when your neck stops doing its own thing. Another helpful option is physical therapy. Think of it like a workout plan, but just for your neck. A physical therapist will show you exercises that help strengthen your neck muscles and improve your posture. Over time, this can make a huge difference in how you feel. Plus, they'll teach you stretches that can ease any pain or stiffness you might be feeling. We've also got medications that can help calm down those overactive muscles. Things like muscle relaxants, you might have heard of baclofen or diazepam, that's Valium by the way, can help your muscles chill out a bit so you don't have as many spasms. And lastly, there's surgery. Now I know that word sounds a bit intense, but surgery is really more of a last resort for people who haven't found relief with other treatments. It involves targeting the nerves or muscles causing the issue. It's not common, but it's out there as an option. So, whether you're dealing with cervical dystonia or whiplash dystonia, the important thing to remember is that you don't have to suffer in silence. There are lots of ways to manage these conditions and make life a lot more comfortable. Sure, it's frustrating when your neck has a mind of its own, but with the right treatment plan, we can get you back to feeling more in control. And hey, if you ever feel like your neck's throwing a tantrum or acting up in ways it shouldn't, don't hesitate to talk to your doctor. We're here to help, and we've seen it all before. All right, that's enough neck talk for today. Take care of yourself, and remember, no neck spasm is too strong to be tamed with the right care. Thank you for listening. This has been Dr. Dallas Lee.